What benefits and compensations are available to Vietnam War veterans, and why do these programs remain critically important to ensure a decent life for the heroes who sacrificed their health and youth in the name of their country? The United States makes a serious commitment to Vietnam veterans by providing them with a comprehensive benefits and compensation system that recognizes the sacrifices made by these heroic people during one of the most complex and contentious conflicts in American history. The U.S. Department of Veterans Affairs administers an extensive range of programs designed specifically to meet the medical, financial, and social needs of Vietnam-era veterans. Medical care is a cornerstone of veteran support. The Department of Veterans Affairs provides fully funded medical care in its own network of VA healthcare facilities throughout the country. This includes not only the treatment of acute and chronic diseases, but also dental care, medication prescribing, and psychiatric services. This is especially important for Vietnam War veterans, as many of them suffer from post-traumatic stress disorder related to traumatic combat events experienced decades ago. The quality and accessibility of this medical care often becomes a lifeline for people who otherwise would not be able to afford treatment. One of the most innovative and fair programs is the disability compensation system based on the principle of presumption. If a veteran served in Vietnam between January 9, 1962 and May 7, 1975, he or she is considered to have been exposed to Agent Orange defoliant, even if this cannot be documented. According to this principle, a whole list of diseases, including type 2 diabetes, Parkinson's disease, various types of cancer, chronic obstructive pulmonary disease, and other pathologies, are automatically recognized as related to official duties. Veterans who are diagnosed with these diseases receive monthly tax-free payments, the amount of which depends on the degree of disability. The expansion of this protection was due to the adoption of the PACT law, which increased the number of veterans eligible for compensation and preferential treatment related to exposure to toxins. This law applies to veterans who served not only in Vietnam, but also in Thailand, Laos, Cambodia, or on warships in certain territorial waters of the Southeast Asian region. The pension program provides monthly tax-free payments for veterans of the war era who have either reached the age of 65 or are disabled and have a low income. This financial support helps to ensure an adequate standard of living for those who are no longer able to work and depend on government assistance. Of particular importance is the Aid and Attendance Program, which provides additional payments to the basic pension for veterans and their spouses who, due to their advanced age or serious health problems, need constant care or daily assistance. These payments can be used to pay for the services of a guardian, stay in a nursing home, or other forms of care. Given that many Vietnam War veterans are now in old age and suffering from multiple chronic diseases, this program provides critical care. Housing support is provided through the VA Home Loan Guarantees Program, which offers government guarantees for obtaining mortgages on exceptionally favorable terms. Veterans receive preferential interest rates and the opportunity to get a housing loan without a down payment, which makes their own housing affordable even for those with limited financial resources. The education program provides financial support for higher education, professional retraining, and skills development, allowing veterans to adapt to civilian life and find new professions.
The government also recognizes its debt to the families of veterans. The biological children of Vietnam War veterans who are diagnosed with congenital diseases such as spina bifida are eligible for monthly government compensation. This is a legacy of the Vietnam War, when exposure to toxins led to birth defects in the offspring of affected veterans. Information about specific programs and the application process can be obtained through the official portal of the U.S. Department of Veterans Affairs. For those who need help with paperwork or filing appeals, free legal aid is available through various veteran organizations. What do you think about this?